Are on the rise across the country. The CDC estimates there have been more than 15 million cases already this season. On this map, you can see most of the states highlighted in red or shades of purple, including Washington and Idaho. That's showing high or very high flu activity. Mary Sheridan shares what local hospitals are doing to help stop the spread as cases are expected to continue to rise.
Starting today, visitors under the age of 18 are not going to be allowed in certain units of the Sacred Heart Medical Center. This includes the Children's Hospital, Labor and Delivery Unit, and Women's Health Center. This is meant to protect staff, patients, and visitors alike. On top of this new visitor policy, Sacred Heart is also masking up.
We're seeing roughly 2% of all of our emergency visits in the state are related to influenza, and that's our trigger to start implement masking, help keep patients and our staff safe.
Because it's not just the flu that's going around. In combination with RSV and COVID-19, this is one of the worst seasons for respiratory illness since 1997 to 1998.
We are seeing a lot of respiratory illness come into our emergency room.
That's not to mention urgent care visits and those riding out the illness at home. So MultiCare's hospitals are now requiring their staff to mask up as well.
The flu is crafty. It mutates. So every year it's probably a little different than it was the year before, and it's a little different than we protect.
Dr. Alexander Hurd is the Chief Medical Officer for the MultiCare Health System. He explained that this year's flu has a mutated strain that wasn't anticipated when this year's flu shot was developed, but it still protects you and can help you get back on your feet quicker.
Over time, if you think about building a library of 4 different strains of flu every year, even if the flu is not exactly covered by that year's vaccine, you might have had one in the past that's close.
Besides getting a flu shot, doctors say to wash your hands and stay home when you're sick.
We're right on the very early uptake of this, so I think we have probably 4 or 5 rough weeks ahead of us.
Sacred Heart's Chief Medical Officer Dan Getz says the hospital plans to reevaluate their visitor policy in the spring. For 4 News Now, I'm Mary Sheridan.